The Wisconsin Department of Health Services announces changes to immunization requirements for child care centers and schools. First News at 9's Kim Leadholm explains how some of these changes will affect local child care centers.
Child care centers in Wisconsin are now following new immunization requirements through the Wisconsin DHS. The change surrounds the chickenpox vaccine and documentation for it.
In the past, parents were able to just notify the health department or their school or child care facility if the child had chickenpox. With the new updated requirements, parents will actually need a physician or a healthcare provider certifying that their child had chickenpox. If they're not able to provide that or laboratory proof of the illness, then they would need to get the chickenpox vaccine.
Christina Ritz, a public health nurse with the Eau Claire City County Health Department, says these changes will help the state follow CDC guidelines.
The changes will help us align with CDC's recommendations at a national level. And are really important so that kids can stay healthy. We're always looking at ways to better protect our children. And so we've had changes in the last decade to the Wisconsin immunization, the requirements for schools and child care, and it's not uncommon.
As for specific cases of chickenpox, Rich says that's not a major concern, but you can't be too safe.
Across the country, there are still documented cases in our county. We haven't seen any recent spikes, but again, to be able to keep our kids as safe and healthy as possible, it's important to have those documented appropriately.
These new changes will not affect Wisconsin immunization exemptions around religious, medical, or other philosophical reasons.
In addition to chickenpox vaccine changes for child care centers, 7th grade students in Wisconsin are now required to get vaccinated against meningitis and whooping cough. The Wisconsin Department of Health Services says students are already asked to receive Tdap shots at the start of 6th grade. Health officials say the change better aligns with the shots kids receive at the age of 11. In addition, a booster dose of the meningitis vaccine will be required at 12th grade.
There's actually a rise in this form of meningitis called meningococcal meningitis that starts to rise earlier in the teen years, and then it has two peaks, one before college and then that highest peak for those college freshmen living in dormitories.
According to the Wisconsin DHS, there will again be no change to the exemption options for medical, religious, or philosophical reasons. Flu and COVID-19 vaccinations are not required, but are recommended.